Welcome back. Joining us now is Dr. Daniel Cobb. And Daniel, your specialty is cardiology and cardiac electrophysiology. Kind of a mouthful. We're going to talk about what that means. Thanks for being here today.
Thanks for having me.
So lots to discuss, but you are what many call a cardiac subspecialist, and your own cardiologist partners referring to you as their heart electrician. I love the way that sounds. Can you begin with telling us exactly what cardio electrophysiology is and just kind of sum up what you do?
Sure. So cardiac electrophysiology, like you said, is a subspecialty in cardiology where we really focus on the treatment and management of complex cardiac arrhythmias. This includes things like atrial fibrillation, which is a very common heart rhythm disorder, as well as a variety of other conditions. And we also manage implantable cardiac devices, such as pacemakers and things called implantable cardiac defibrillators.
Okay, so I want to spend some time, and we're going to unpack this a little bit further, but a big part of what you do surrounds treating atrial fibrillation. And most people know that, of course, as AFib. So let's talk about AFib, what it is it hereditary, and is it common? Do you see it a lot?
Yeah, so atrial fibrillation is probably one of the most common heart rhythm disorders that I deal with, and can be fairly common, particularly as folks get older. Essentially, atrial fibrillation is an irregular heart rhythm, where if you think of normal heart conduction, electrical activity, it occurs in a very coordinated fashion. It starts at the pacemaker cells in the top chamber of the heart and then spreads out over a specialized conduction center into the bottom chambers. Every time we have a heartbeat, it's normal in a very coordinated, controlled fashion. However, people who have atrial fibrillation, their top chambers, rather than beating in a coordinated, in sync fashion, the electrical activity occurs very erratic and irregular. This can cause the heartbeat to go fast sometimes it's too slow, sometimes it's erratic and irregular, and a lot of patients are incredibly symptomatic with this.
Yeah, that's interesting. I've never heard it described exactly like that. That's helpful. Let's talk a little bit about what makes people more or less susceptible to heart arrhythmias. Is there something that they can or can't do, or what makes a person more susceptible?
Sure. So a lot of the traditional cardiovascular risk factors that we think about that put people at risk for heart disease can also contribute to the development of arrhythmias. So things like coronary artery disease, high blood pressure, diabetes, obesity, as well as untreated sleep apnea can all put people at risk for developing or having worsening atrial fibrillation. So really kind of managing those risk factors is very helpful sometimes in preventing arrhythmias. Oftentimes people can have particularly atrial fibrillation in the setting of structural heart disease. So like Dr. Babcock sometimes talked about, sometimes valvular issues can lead to arrhythmias. And then sometimes people have heart rhythm disorders for reasons that aren't clearly understood.
Okay, so is there something that someone can do to prevent it? I mean, it sounds like, especially in a case where there's not an understanding of why it's there and where it's coming from. Prevention for viewers, is there something to be done? So
I think leading generally a heart-healthy lifestyle, so making sure you eat healthy, getting good exercise, being active, fit, it can be very helpful in the prevention of cardiovascular disease in general and also in the development of certain arrhythmias. Certain things that can be particular risk factors for arrhythmias can be excessive alcohol intake. So moderating or reducing your alcohol intake can also help with management of these things as well.
Okay, so some healthy lifestyle things to really take into consideration. I want to spend the last minute or so we have to talk about procedures. So you specialize in a variety of minimally invasive procedures and heart-related implants. Let's talk about what you see most frequently.
Sure. So in management of atrial fibrillation, we've really come a long way over the last few years, and so aside from just medications, which can be effective some of the time, a lot of what we focus on is treatment of heart rhythm disorders with something called a catheter ablation, which is a minimally invasive catheter-based approach where we actually go through the veins into the heart and we create electrical maps of the rhythm disorders and then use a technique called radiofrequency ablation to essentially burn or cauterize the little short circuits that are causing the rhythm disturbances. Aside from ablation, we also focus on implantable cardiac devices. Like I mentioned before, these are pacemakers, so things designed to treat slow heart rhythms. And we also do implantable cardiac defibrillators for people who have sometimes dangerous heart rhythm disorders that may require electrical shocks to help people. Additionally, as Dr. Babcock mentioned, we also do the Watchman device, which is designed to help people come off of anticoagulation or blood thinners and prevent strokes that are associated with atrial fibrillation.
Wow, lots to take into consideration, but we appreciate you explaining this in a way that we can really understand. Obviously, a lot of knowledge and specialty under one roof. So thanks for your time, Dr.
Absolutely,
Cobb.
happy to be here.
We've got lots more for you coming up on Living Smart at St. Joseph's Candler. We'll be right back.